My name is Thomas J. Casey. I've been a patient several times at Chippenham Hospital. Had a heart pacemaker installed, had a heart valve installed, and had 6 bypass open heart surgery done 8 years ago. And I've been there several times for checkups and for these other procedures. And it's been first class all the time. Everybody's organized. Dr. Garnett is my cardiologist, and ever since I had these heart issues, he's been taking care of me.
Mr. Casey presented years ago with chest pains and ultimately was found to have severe blockages in the blood vessels around his heart and underwent bypass surgery. He had a very weakened heart muscle initially, but he did great with the surgery, made an excellent recovery. His heart function went back to normal, but we did discover that he had aortic stenosis, which is narrowing of the aortic valve. Typically, the earliest symptoms would be shortness of breath with doing activity, decreased stamina, but it can progress to the point of having chest pain or dizzy or episodes of passing out or fluid buildup.
Ever since I got out of the Army, I've been active, I've been running. I've run the marathon 5 times. We have a house on the Outer Banks, and to carry the luggage, it's one of those on stilt houses that carry the luggage up and down those steps. I'd make one trip up and then I'd have to sit down. And for a while, then I come back down and I get some more suitcases and I take a trip up again. Sit down, I thought, geez, this is getting old. It's really a pain in the neck. I called my doctor and they happened to be there. And they said, come in tonight. And they wanted me to do a pacemaker and a valve at the same time. So the doctors got together and discussed it, and they said, okay, pacemaker first and wait a couple months and then the valve.
We felt that a traditional open heart valve replacement would be a higher risk for Mr. Casey, given the fact that he'd already had heart surgery in the past. There's several benefits of the less invasive TAVR procedure compared to the traditional open heart surgery. There's fewer complications, especially in someone who's had previous open heart surgery. There's less discomfort for the patient, and the recovery time is much quicker. Many of our patients go home within a few days, and he did very well with the procedure. He got a great result, had a very quick recovery, and was at home a few days later.
When I went to the rehab, I could tell I was getting better there when I was on the treadmill and stuff like that. They have their own little gym that I could go to, and they put a computer on you and measure your output of energy and your heart rates and blood pressure. I didn't realize that my heart being so slow is very slow beating, and how it would make me tired so much. Go and get checked out, and then get a doctor you're comfortable with and that communicates with you, spends some time and talks to you, and then decide. I'm glad I did it, I wouldn't be around if I didn't do it. So it's been a good experience, it's kept me alive.